亦都已經夠法定人數，咁我哋依家開始嘅會議。
Colleagues, let's start our meeting. Please invite the deputations and individuals to come in. Yes, I think the government representatives can also come in. Members, in relation to the enhanced regulation of pharmaceutical products in Hong Kong, we've received a supplementary information paper from the administration, and the Electrical Secretariat has also prepared a background brief for us. 2 deputations will not attend: Consumer Council and Retail Management Association, but they've sent in their submissions. A number of members of the Pharmaceutical Society of Hong Kong have separately submitted a letter to us that has already been distributed to you before the meeting. Welcome, Under Secretary. Welcome, deputations and individual members of the public, for attending the special meeting of the panel on health services. First of all, I have to remind you that your remarks here and your written submissions are not protected by the Electrical Powers and Privileges Ordinance. In simple terms, you have to be responsible for your own remarks. I believe all of us understand Cantonese, so we don't need to use the microphones. So 3 minutes each for deputations and individual members of the public. So please be concise and succinct. If you cannot finish, you can send in written submissions after the meeting. First, Hong Kong Doctors Union. Where are they? On that side. Sorry, I thought you were here. Dr. Yang Chiu-Fat, President of the Hong Kong Doctors Union. Thank you, Mr. Chairman. Our Doctors Union has about 2,000 odd private medical practitioners. Most of them are private medical practitioners. Thank you for according us this opportunity to speak on the proposed 75 recommendations on enhanced regulation of pharmaceutical products. We would like to promote the health of our patients. However, we have a number of worries. In particular, I'd like to mention one point. That's about written prescriptions. Back in 2005, 2007, and 2009, we conducted a number of surveys amongst our member doctors. the returns indicated that 90 or to 100% opposed the placement of orders in writing. Under the manners of the officials of the Food and Health Bureau, they still opposed the proposal. For so many years, we've placed bookings via the telephone, emails, written correspondence, and so forth. So we do not want to turn the clock back. So we feel regrettable about their recommendations. For telephone bookings, we have a two-way communication. We have to discuss what drugs the doctor wants, what products are available from the supplier, and what drugs should be provided at what time and in what quantities, etc., etc. So if this is to be done in writing, a lot more work will be required before we arrive at a final order. Even if we have a final order, the supplier may say that they don't have enough supply. We order 100, they may just send us 80. The ultimate invoice is the final order. And these orders have to be stored for future checking. This is not conducive to environmental protection. And if this is to be done in writing, delivery may be affected, patients' health may also be affected. And I understand that the pharmaceutical factories may incur higher costs as a result. So we oppose the recommendation. Sorry, if you have other comments, please submit them in writing. Next speaker, Hong Kong Alliance of Patients Organizations, Mr. Lam Chi Yao. Thank you, Chairman. We have 40-odd patients associations covering 20-odd diseases. Before this meeting, we sent out a request in writing asking our members association to air their views. We also consulted representatives of the industry. Now, there are two issues here. First of all, whether private medical practitioners should place orders in writing. We support medication safety, and patients' interest should be our first and foremost concern. There should be a sound regulatory regime. However, if you look back at past incidents and major medical incidents, manufacturing, prescription, and the taking of drugs are the major concerns. Whether written orders can safeguard patients' interest, we have doubts. Last time, the administration mentioned illegal transfers. Of course, we're concerned about that. That's a very serious allegation against doctors. I wonder whether the Bureau has any statistics to support it. A more practicable approach is like this. We support the written approach, but we do not want to incur higher costs, and we do not want to be burdened with documents such that doctors cannot focus on their profession. So there should be a comprehensive electronic system such that doctors can immediately know whether or not the suppliers can supply the required quantities of medication in time. As for the pharmacist, should he be required to be resident on site throughout the operation hours? When dispensaries employ pharmacists, they may have recruitment problems and higher costs may be incurred. Last time we learned that the administration is contemplating legislation. We have reservation over this approach. Without any statistical support if the administration forces the law on us without actually knowing the commencement date of the legislation is not a desirable approach. And then in the process of legislation, we would like the administration to consider the number of pharmacists, the number of dispensaries, etc. So the government must pay attention to statistics and data. And we would like to have timely legislation only. Silence, please. Next. From the Chinese University of Hong Kong School of Pharmacy, Professor Vincent Lee, Professor and Director. Should I use Chinese or English?
2011, in applying for the PEG standards, in 2013 are the two milestones in the ongoing transformation of the regulation of pharmaceutical products in Hong Kong. The legislative proposals for which our opinion is sought this morning represents the third milestone. The legislative amendments of the PMP ordinance would empower the drug office to implement the CGMP or PEG standards and to enforce complementary drug safety measures. While drug safety begins with the quality of the drug product, the paradox is that quality drugs do not necessarily mean safe drugs. Quality drugs in the wrong person will not help but may even cause harm. The pharmacist with advanced training is the only healthcare professional with the panoramic view of drug safety and the know-how to assess how drug efficacy in the patient can be modified by the lifestyle, genetics, and drugs taken concurrently with other diseases. That's why pharmacists must be on duty in pharmacy during business hours to provide the drug quality, safety, and efficacy check. The public expects that, just as he expects the person making diagnosis in the doctor's office is a licensed physician, no matter what time it is within the window of business hours. At the heart of the debate of business hours is pharmacists' manpower to not only support the expanded role of the drug office, but also to provide oversight of the drug therapy of many patients. The current shortage of pharmacists to staff all the sectors in pharmacy can no longer be ignored. 2 years ago, CUHK stepped up to increase its student quota from 30 to 55. Together with Hong Kong U, only 80 students are enrolled each year. This is 4 times lower than projected by the WHO standards. Moreover, students enrolled in 2013 will not graduate and practice independently until 2018. The underutilization of pharmacists in the gap in drug safety in Hong Kong now, with the rippling impact in productivity and burden on the already overextended healthcare system. Another drug safety measure is written documentation and record keeping for all transactions. The requirement of written orders from doctors and retailers is a good practice. One can only imagine that at the time of recall or withdrawal from the market, a paper trail of verifiable records will allow expedient tracking of the product and alerting the patient. Therefore, 100% compliance with written orders is a must for the sake of the public health. In summary, the legislative proposals to amend the PPO is sound, and I support all the recommendations. A realistic action plan is needed to correct a long-standing shortage of pharmacist manpower. There must also be opportunities to pursue and implement advanced pharmacy patient-centered practice. Thank you for the opportunity to share my views on the legislative proposals.
唔該晒李教授。第4位發言嘅香港私家醫院聯會嘅代表阿彭志宏。
Next, Dr. Peter Pang from Hong Kong Private Hospitals Association. We do not have any submission, Mr. Chairman.
下一位發言嘅
Next, from Hong Kong Dental Association, Vice President Dr. Wong Chi-wai. Thank you, Chairman. The Hong Kong Dental Association notes the recommendations put forward in December 2009 by the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong to step up regulation of the industry, and we support the government's proposal in protecting or safeguarding the public health. We support the measure to tighten up the regulation on authorized seller of poisons, ASP. On the 75 recommendations, we'd like to have the following comments on recommendation number 37. On the written order of drugs, we agree with this requirement because this will minimize the risk in the transaction of drugs as they are verifiable and this should be incorporated in the code of practice. We support it as well. But we think that electronic forms like email, Facebook, SMS, so on and so forth should be incorporated as well, so that orders can be placed via email and can be filed in the record. As for reminders to patients on the safe use of drugs, according to our guideline, there should be labeling of drugs which should include the dosage and patient's particulars and the possible side effects, etc. We don't oppose the idea of giving patients reminders on the use of drugs, but a comprehensive guideline should be formulated by the relevant council bodies, such as the medical council and the dental council, so that the patients would be made known of the proper dosage and on whether or what particulars should be included in the label. We think that it could be done with proper disclosure, because patients may not have the knowledge of the drugs, and patients may only be half informed just by reading the labels, and this might be dangerous for patients, and burden may be imposed on the trade. Thank you. Next, Dr. Li Xingzhang, Chairman of the College of Pharmacy Practice. Thank you, Chairman. The College of Pharmacy Practice supports the 75 recommendations put forward by the Review Committee on the regulation of pharmaceutical products in Hong Kong, so as to enhance the standard of the trade and safeguard public health. We have some comments, but we want to reiterate before I start that the following principles. We believe pharmaceutical products are different from other products. There is a risk, so throughout the supply chain, from manufacture to sale, there should be proper training, and there should also be a proper code of practice. And the ultimate aim is to safeguard public health through the use of quality drugs. We have the following comments. First of all, on recommendation number 6, registration and removal of ASP, we support it, but we think that registered pharmacists and I think the person responsible for registration and removal of registration should be carried out by a person with the pharmaceutical or with a pharmacist qualification, etc. And also on licensing matters, the administration doesn't intend to license non-poison selling sellers, but we think that they should also be subject to inspection, monitoring, etc. Number 3, ASP. We believe and we support the measure. It is the important duty of the dispensaries to dispense drugs, as well as provide basic information to patients and remind them to contact doctors if necessary. So this is the responsibility of pharmacists, and we support the requirement that pharmacists should be on duty at all times at the premises. However, we should consider how we can fully utilize the knowledge of pharmacists. At the 2 universities at the moment, there are 80 places for pharmacist training. There should be a timetable to provide more places, and on how the roles of pharmacists can be fully utilized in the community, we should consider it. And we also support written order of drugs. Next, Dr. Che Hong Hing, President of the Hong Kong Medical Association. Hong Kong Medical Association is the largest union for doctors in Hong Kong, and we support this proposal floated by the review committee, including the written order of drugs as a requirement. As a private medical practitioner, over the past decade or so, I have been placing orders in writing form via fax. I felt no pressure at all, no extra burden, no extra cost. And the advantage of written order of drugs is that we can curb the illegal sale or trading of drugs. And this is the best way to provide evidence to the authorities. And in the past, there were incidents which have been widely reported by the media that orders have been placed via telephone, and as a result, patients suffered. So as a professional body, and also on drug labeling, in fact, I drafted the requirements on drug labeling, and these are stringent requirements. Doctors may be subject to revocation of their qualification if something goes wrong. And on pharmaceutical products, similar arrangements should be made to safeguard public health. Pharmaceutical products in Hong Kong, the question is not about legislation. The question is on enforcement. I won't say that we have inadequate legislation or regulation in Hong Kong. The question is there is a problem with enforcement and the penalty is not heavy enough. And I read from media reports that you can buy cancer drugs, let alone antibiotics, everywhere in dispensaries in Hong Kong. So it totally shows that something is wrong with the government's effort in regulating the trade. Several years ago, because of an error in the dispensary of drugs, some patients died, and the problem has to do with dispensaries selling drugs to patients without prescriptions. And in such circumstances, should the pharmacists who are not present at the premises be punished as well? So that is a question, or there is a problem on the enforcement of regulation. Next, from Hong Kong General Chamber of Pharmacy Limited, Mr. Cheung Tak Wing, Director of General Affairs. Thank you, Chairman. Thank you. Good morning, honourable members. Well, I'd like to give the comments on behalf of the General Chamber on the proposal. We have 238 members. We own half the share in the market, so I hope weight can be given to our comments. In principle, we support the proposal to safeguard public health. However, a practical approach should be taken, and history should be given due regard, and we should also look at the reality under the principle of a fair, just, and open principle. And the medical profession and the pharmacists have due checks and balances as separate disciplines to safeguard public health. Now, in advanced countries in the West, they have adopted this approach, and in Asian countries like South Korea and Taiwan and Hong Kong, etc., this is also the case. It's in Hong Kong, the private sector is left out. So the legislation should be amended to incorporate the private medical sector under its regulation. Now, Dr. Ko-Wing-Man has proposed that the pharmacist should be on duty at the business premises during business hours. But normally, dispensaries operate 14 hours daily, and there should be at least 2 pharmacists. So if the legislation is passed, it should be implemented at the proper time. As the open government, the government should consider allowing the legislation to take effect at the appropriate time, because we are short of pharmacists at the moment, and we should wait for several years before we have sufficient pharmacists. And dispensing prescribed drugs is only one aspect of the business of dispensaries. And on recommendations 30, 31, 32, 33, and 74, we oppose them. So I hope members will also consider our comments when considering this proposal. Thank you. Please be quiet. Next, Assistant Professor Dr. Jenny Lam from the Department of Pharmacology and Pharmacy, the Hong Kong U. Well, in 2009, the Hong Kong U started this course, and every year we enroll 20 to 39 students. And the first batch of students have graduated. We support the 75 recommendations. The primary concern should be on patients and public health. We would like to see the quality of the trade be enhanced, or standard of the trade be enhanced to avoid major medical incidents. On recommendation 30, whether pharmacists should be present as the ASP whenever the ASP is open for business, we think that this is necessary because this can enhance the service of ASPs. On insufficient manpower and the difficulty in its implementation, we understand that, and we have around 80 students graduating per year because of additional places. And we believe that in 3 or 4 years' time, there should be sufficient manpower to meet the requirement of increasing the manpower by 1/3 to allow the implementation. We think that we should not wait until we have sufficient pharmacists before this take effect. And also we agree to the proposal of written order of drugs. Next, Ms. Sabrina Chan, Executive Director of the Hong Kong Association of Pharmaceutical Industry. Thank you, Chairman. We supply 70% of the R&D drugs in Hong Kong. We are concerned whether this can tie in with the reality of the trade, and we basically support the 75 recommendations proposed by the review committee. And during the consultation exercise, the trade already reflected their difficulties. Now we have the following comments on written order of drugs. This is an important part of risk control. In other countries, very rarely do we see the lack of a requirement of written order of drugs. The information includes the batch number, quantity, etc. However, we still have errors on storage of drugs. As far as temperature control and humidity, there are requirements. Syringes, for example. Sometimes the drugs cannot be used after certain conditions. They must be destroyed, and written order of drugs, this requirement will help minimize the situation. And for the other recommendation, we understand that our habits might have to change, and there might be extra costs to upgrade our system. But we are an international city. We should improve our regulation on the process of drugs. And for registered pharmacists who should be present at the premises. In Singapore, Malaysia, and Vietnam, we have similar regulations. We agree we agree to this recommendation. When we understand there is insufficient manpower, we agree that we should wait for sufficient manpower before its implementation. However, resources should also be taken into consideration, and therefore the code of practice is very important.
Next, Ms. Iris Chang, President of the Practicing Pharmacists Associations of Hong Kong. We're one of the biggest similar associations in Hong Kong. Our pharmacists are frontliners. Our opinion is that we may be affected by the proposed legislation. There are these people who don't work on the front line. They may just imagine certain scenarios. That's why they would like to implement such a piece of legislation for enforcement. So please attach more importance to our opinion, because in our posts, we are most certain about whether or not these recommendations are practicable. We discussed these recommendations without proper legal advice for us. When the 75 recommendations were released, we consulted our own lawyers, and some recommendations are not rational, not legal, and unjust. For example, a key should be left in the dispensary. Now, the pharmacist cannot accept this. Otherwise, according to the Landlord and Tenant Consolidation Ordinance, only the owner of the premises or the tenant should own a key to the premises. So, if the pharmacist is not the proprietor of the dispensary, then this recommendation is not fair to the pharmacist. Because if you're not the boss, you cannot ensure that there's only one key to the premises. So pharmacists cannot accept this. This is just a trap. After receiving the key, the pharmacist has to ensure that the locked containers in the premises should be intact. No less and no more drugs should be in the container or in the locked room. So unless there is a very good defense against prosecution, it's unfair to the pharmacists. If there's to be a prosecution, the consequences can be serious. In other jurisdictions, a pharmacist, if convicted, may lose his license. Same for insurance brokers. So if an innocent pharmacist, because of a legal loophole, suffers, or if the pharmacist does not understand his legal liability, and if he is to lose his means of livelihood, it will be a very serious problem. Some people may think that this may not happen, but in fact, we did have such incidents. Thank you. Next, the Society of Hospital Pharmacists of Hong Kong, Mr. William Choi, their president. Our society covers pharmacists in the public and private sectors and serving over 90% of the patients in Hong Kong. The review committee put forward 75 recommendations to amend the ordinance. We have the following suggestions. The COP should be used to govern the manufacturers, the suppliers, and relevant parties. But pharmacists, like doctors and nurses, should be covered by their respective COPs. So we propose the setting up of a special committee to regulate our conduct. In the review committee, I suggested that a Center for Safety of Equipment and Drugs should be set up as soon as possible to safeguard public health. As for the authorized person, he must be a pharmacist. Only a pharmacist has sufficient knowledge and morality to understand how drugs are manufactured. This is something to do with expert knowledge as well as professional conduct. As for the requirement of a pharmacist on site throughout the operation hours, we support it. Every year, as the Hong Kong U said, together with the Chinese university, there are 80 graduates, plus graduates from overseas jurisdictions. We have about 100 per year. So in 4 to 5 years' time, we'll be able to comprehensively enhance the provision of pharmacists in dispensaries throughout the operation hours. And pharmacists must have something to do. So public-private collaboration or partnership should be considered. In certain institutions, drug prescription can be passed to the pharmacists, such that patients will get genuine medication support. In the community with a lot of pharmacies and dispensaries, we have 3,900 retail outlets that sell medicine, 3,900 odd. But for formal pharmacies, we only have 590. And orders should be placed in black and white, because documents in black and white represent honesty. So wherein where necessary, we have to protect the patients. So we support the recommendation. Even though a minor cost is to be incurred, it's worthwhile. Next, Mrs. Mary Catherine Chang, President of the Pharmaceutical Society of Hong Kong. Mr. Chairman, our society supports most of the 75 recommendations and the necessary amendments proposed by the review committee. However, we would like to offer some comments. Recommendation 30 proposes that throughout the operation hours, a pharmacist should be on site. In the private market, the medical profession, well, all prescriptions are actually written by doctors and drugs are provided by doctors in the private sector. And in a clinic, there may not be professionally trained and qualified personnel to oversee the prescription and delivery of drugs. There may not be a registered pharmacist. So to protect patients, pharmacy and the medical profession should be separated so that doctors and pharmacists can play their respective professionalism to the full. In fact, this is being done in many jurisdictions. In 1995 and 1999, our association already put forth this recommendation, and we suggest a broad consultation exercise in Hong Kong so as to protect public health. So there should be a segregation between the medical profession and the pharmacist profession. As for recommendation 31 in relation to Part 1 poisons, the recommendation is that the key should be held by the pharmacist. In terms of implementation, there is a certain degree of difficulty because in most cases, pharmacies and drugstores or dispensaries are not owned by the pharmacist. Well, even for your home, you won't just have one key. There's always a spare key. So there will be implementation difficulties. As for written orders, we support the recommendation because only written orders can easily allow the Department of Health to do audit trail. Thank you. Thank you. Silence, please. Next, Hong Kong Pharmaceutical Manufacturers Association, Mr. Chang Yu-Kwang, their Vice President. Thank you, Chairman. Our association basically supports the administration's proposal to amend the regulation of pharmaceutical products in Hong Kong in relation to the Pharmacy and Poisons Ordinance, the PPO. We normally adopt PICS, a system adopted by the EU. It is proposed that the system be fully implemented by the 1st of July 2015. Science and technology are ever advancing. We don't want this to be written into the law. We believe that the Pharmacy and Poisons Board, the PPB, should take care of this regulatory regime, because the PPB understands more the latest development of science and technology. Maybe in a few years' time, we'll have new standards and higher requirements. Then the PPB can consider the implementation details where and where necessary. We don't need to write that into the law. As for recommendation 24, it is that manufacturing processes can be outsourced and the products can apply for registration in Hong Kong. This is opening a loophole in Hong Kong's laws. We would like to enhance the manufacturing standard of Hong Kong's pharmaceutical products. If you suddenly open this loophole for wholesalers to outsource the manufacturing of drugs and later bring them back into Hong Kong for registration, is unacceptable. We have to regulate licensed GMP locally, such that the law enforcement agencies of Hong Kong can inspect the manufacturing premises to do audit and inspection. So we must not allow such a big loophole to exist. As for labeling, under the existing legislation, the poisons label is being used. This has disturbed the public for decades. We hope that in future, these labeling requirements should be handed to the PPB for handling. For example, how the terms should be expressed in Chinese, etc., etc. Then we'll be able to advance with time and improve ourselves. Next, the Pharmaceutical Distributors Association of Hong Kong Limited, Mr. William Choi, their chairman. Thank you, Chairman. Our association represents importers for supply of drugs to hospitals, clinics, and drugstores, etc., or pharmacies. Overall speaking, the recommendations do match the reality of the market of Hong Kong. On the 18th of November, at a meeting of this panel, certain measures were proposed in relation to transfer of drugs. We believe that those proposals will only create confusion and will not be able to curb illegal transfers. Say, if the user orders 100 pieces and only receives 50, there may be illegal transfer. But even if all the 100 pieces are received, there can still be an illegal transfer. So, even written orders won't be able to control such situations. At present, we already have a system in place. We must have a license from the Department of Health. We have to keep records of supply and demand. So, in fact, we have a good regulatory regime at the moment. And then concerning confusing use of terms, Well, sometimes the client may order 100 pieces and the supplier can only distribute 90. Then a written order for 90 pieces, if required, will cause delay in supply. Besides, both parties may hold a written order, but in fact there's only one transaction. So when records are being counter-checked, there will be discrepancies. So this mandatory requirement will only incur costs on the suppliers and patients and will only have very limited effect on protection of patients' interest.
So Dr. Ms. Chiang is not here. So the next speaker, Professor Vivian Lee Wing Yan, School of Pharmacy, Chinese University. I speak in the capacity of a pharmacist. I support the 75 recommendations proposed by the review committee. The role of a pharmacist is, first of all, to ensure the safe use of drugs and also to enhance the patient's knowledge on the drugs. And patients together and pharmacists together with doctors and nurses are part of a professional team. On the two controversial recommendations, i.e. written order of drugs, one of them, I think that it is necessary because we need written orders to verify the content of the order to ensure safety. And the second recommendation, which is more controversial, is that the pharmacist should be on duty at the premises during business hours. I support it because for doctors, they must also be present when the clinic is open for business, so that the same case should also apply to pharmacists. Some quote that the figure for registered pharmacists are not sufficient. But as said by the Hong Kong U spokesman and the CU, every year we have 80 graduates. So this is a matter of chicken or eggs. So if we can enhance the role of pharmacists in this professional team, we can safeguard the health of the general public. And separating the disciplines of pharmacists and medical practitioners. Well, we have been debating on this topic for a long time. For private clinics, we should consider the introduction of the two separate disciplines as well, so as to enhance the care for patients. So in short, if we can enhance the role of pharmacists in safeguarding the safe use of drugs, it is important. Next, Dr. Ho Ming Tai, founding president of the Association of Doctors in Aesthetic Medicine, Hong Kong. Thank you, Chairman. After the incident of DR, we set up this association for the purpose of enhancing the standard of practitioners engaged in aesthetic medicine as well as safety. Our motto is above all, do no harm. Our primary mission is that we must not do any harm to patients. We have over 30 doctors who are members of our association. They are mostly GPs who are also engaged in aesthetic medicine. We also have pediatrics and also other practitioners practicing cosmetic surgeries. So we support many of the recommendations. However, for written order of drugs, we have reservations. If there is an urgent need to place order for certain drugs, we might not be able to place order in writing, and the patient's interest will be affected. delay in the order of delivery is a real problem. So we oppose it, as it will harm the patient's interests. For placing orders verbally, there are advantages. First of all, we can discuss and exchange with the agents of manufacturers. We can check the progress of developing new drugs for certain conditions and whether there are side effects. If only written orders are allowed, this will hamper exchange. And just now we have heard valuable views on how to define written order of drugs. I personally think that viable methods include email, SMS, WhatsApp, fax, etc. These are possible methods, but of course we need to define what is meant by placing order in writing. However, there are problems arising from placing order in such a manner, as I mentioned. For example, the agent of the manufacturer might ring and tell the doctor that there are certain new drugs, so on and so forth. So it will be too rigid if orders are confined to written form. As for Dr. Che Hong Hing's, I'm sorry your time is up. You can supplement your comment in writing. Dr. Kenneth Fu is not here. So next, Mr. Albert Tang, Chairman of the Hong Kong Suppliers Association Limited. Thank you, Chairman, members, doctors, members of the medicine profession. Our association comprises members who supply products that can be consumed to not only to patients but to consumers. This is about safeguarding patients' rights. Actually, it's not related to us, but we're here because of recommendations 18, 19, and 29 in relation to Part 2 poisons and non-poisons, which will be regulated in a similar manner as that for Part 1 poison. I supply hair dyes. Hair dyes is Part 2 poison. According to Hong Kong laws, hair dyes is actually part of Part 2 poison. So it's necessary to regulate this product. I'd like to ask the administration why. For non-poisons, they are not for patients' consumption. I'm on vitamin pills as well. I go out and buy them. So is it necessary to have tight regulations? We have heard opposing views today on products like non-poison products such as hair dye, etc. We oppose their regulation. Like Dr. Che Hong Hing said, the question is not on legislation but on enforcement. The government doesn't have sufficient manpower. Sometimes pharmacists don't even know that they're selling drugs, and on improper labeling, reports might be made to the Department of Health, and after half a year, the Department of Health might say that it has nothing to do with that department. In the case, we refer to the Customs and Excise Department, and after another 6 months, only a warning letter is issued. And sometimes, as far as control on storage is concerned, the product might have to be stored in an air-conditioned room. So all in all, I think the control should be relaxed on these products. Next, Dr. Wong To-chun, Vice President of the Association of Medical Practitioners of Societies Clinics. Thank you, Chairman. we represent around 100 doctors who are more senior in age, who practice in society's clinics. And we have no comment on this topic, but we will bring this message to our members that if the legislation is passed, we'll try our best to comply with it. Next, Mr. Paul Leung, advisor of Direct Selling Association of Hong Kong. Chairman, members, the Direct Selling Association set up 34 years ago in 1979. We sell ordinary products like cosmetic products, products for daily living instead of pharmaceutical products. We aim at providing better services to consumers. We also provide 7 days the guarantee of satisfaction, and we have 170,000 retailers in Hong Kong. Actually, it's not for me to make any comment today, but as mentioned by another deputation in recommendation 1819, they touch upon non-poison, and in future retailers should be subject to the licensing mechanism for the sale of non-poisons. For vitamin and other nutrition supplements sold by many members, these products are food in nature. For example, orange contains 15 milligrams of vitamin C, but according to the PPO, it's a non-poisoned drug, a prescription drug, and the retailer will be incorporated in the licensing system. We agree that we should ensure safety of patients, but is it necessary to include vitamins and supplements as well? In 1994, in the United States, through legislation, these products have been treated as nutritional supplements already. And in 2010, in Taiwan, for minerals and vitamins not for the treatment of medical conditions, they have been taken out from the list of drugs and put under the category of food. And a cap should be imposed on the dosage of or the consumption of such supplements, so that consumers understand that they are not drugs but food. This is what we emphasize. The target customers are healthy consumers for the purpose of supplementing their nutritional needs. If the scope of legislation is expanded to cover these vitamins and supplements, we find this unnecessary. This is using a sledgehammer to crack a nut, and this will also impose operational difficulties on retailers. And on vitamins, supplements, etc., we think they should be taken out of the list. Next, Mr. Law Chun Chang from the Pharmaceutical Trade Alliance.
Mr. Chairman, we represent the distributors, pharmacies, drugstores, and wholesalers. Our first point today is that we do not support the recommendation that a pharmacist should be required to be resident in a drugstore, pharmacy, or dispensary at all times of business, because there's just insufficient manpower. And in society, there are not enough prescriptions for pharmacists to work on. If there are insufficient prescriptions in society, pharmacists won't have enough work to do. So the recommendation won't work. And there are other services provided by a pharmacy, a drugstore, or a dispensary. At night or in the evenings, without a pharmacist, such business establishments may have to close. They may have to close on Saturdays and Sundays, for example, thus leading to a great deal of inconvenience on the part of the patients. Secondly, I oppose the inclusion of the COP into the law, because the COP is to regulate the operation of the profession. If it is to be included in the law, statutory procedures may be bypassed, and that's unfair to the profession. And the written order recommendation is not supported by us because there may be rounds and rounds of written correspondence leading to complicated procedures and delay and inconvenience for patients. Thank you. Next, Mr. Chen Kin-man, Vice President of the Hong Kong Academy of Pharmacy. Thank you, Chairman. Our academy provides training and accreditation for professional pharmacists. We have reservation over part of the legislative proposals. In the next decade, we'll encounter more challenges. There will be a huge demand for pharmacists in the next decade because many pharmacists will be retiring. And we need professional services for the patients. And community dispensaries form a very important part of the whole structure. There are other dedicated professionals like nutritionists, TCM practitioners, and other retail services that are serving the public. So members of the public should have the right to obtain other services and products other than prescribed medicine. And if a pharmacist goes off work, the business establishment and its proprietor should have the right to continue to operate and provide other retail services and other products to the public. And we must have a system with higher efficiency and effectiveness to provide comprehensive services to the public. Hong Kong is a metropolis. We must advance with time to match the genuine demand of health care services for the public. So we do not agree that a pharmacist should be resident in a pharmacy throughout its operation hours. All laws must be practicable, fair and reasonable to protect both the pharmacists and the public and patients. A pharmacist should not be tasked with the possession of the so-called sole key of the premises, because the pharmaceutical products in the premises are owned by the proprietor of the dispensary or pharmacy, not the pharmacist. So it is unreasonable and unfair to task the pharmacist with the holding of the sole key of the premises. Next, Mr. Philip Chan, Chairman of College of Primary Healthcare Pharmacy. Good morning, Mr. Chairman. As a frontline pharmacist, I can say that our profession is very concerned about the proposed legislative amendments. We oppose some of the recommendations. For example, personal control of the dispensary is very difficult because we're employed persons. On top of us, we have our proprietors. Sometimes we really cannot control the premises. And now this recommendation brings forth an even more serious problem. If the recommendation is passed, the pharmacist will hold the only key of the premises. If anything is to happen, we'll be held liable. We're not policemen. We're only pharmacists. How can we control everything that happened on the premises? So please consider this dilemma. And then in the EU, in 2009, there was this ruling. if a community pharmacist does not have a pharmacist employer, then the pharmacist does not have autonomy, and he should not be held liable for what happens in the pharmacy, dispensary, or drugstore. I can pass a copy of that to you. In our profession, we're of the view that if personal control and only key recommendations are to be implemented, then the proprietor should be the person responsible. In advanced jurisdictions like Australia, Canada, European countries, and many other Southeast Asian countries, the dispensary proprietor must also be a pharmacist. If that is the case, then in terms of implementation, enforcement, and accountability, it will be easier for the administration to regulate the profession, and that would not end up with the dilemma that we now face. Thank you. Well, the first round of speeches from the deputations and individual members of the public are finished. I'd like to defer to the Undersecretary for an introduction of a supplementary information paper. Thank you, Chairman. First of all, I'd like to thank members of the profession for coming this morning to present to us their views. Before this meeting, we already gave full consideration to those views, and I would like to respond here. For the proposed legislative amendments to the PPO and its subsidiary legislation, the aim is to implement the recommendations in the review report of the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong. If those recommendations are to be implemented, the PPO has to be amended, and we did hear the supported views just now. At the panel's meeting on the 18th of November, we already received certain views from members. Well, basically, there are two categories of views. The first category covers the proposed written orders. I have to reiterate that this recommendation is to safeguard patients' safety. We would like to give the biggest protection to patients. As reflected in our papers, this recommendation will allow the receiving staff of the drugs keep a perfect record and complete the supply chain, and this would help us trace illegal drugs or unregistered drugs or purchase of drugs from unauthorized sellers and suppliers. In our paper, we clarify that written orders will not be covered in this round of the legislative amendments and will be covered in the COP rather. The PPB has already set up a working group to formulate the COP, and consultation has started. Authorized sellers and relevant professions like pharmacists, doctors, dentists, as well as consumers will be consulted. Just now, the deputations, in particular the Medical Association, mentioned that in 2007 they already made this proposal on good practices, that is the good manufacturing practice, the GMP. And the GMP manual should be observed. Our views are the same in this regard, and we believe that this will not add to the burden of professional doctors. But of course, existing practices may have to be modified a little bit, but that's worthwhile to assist the industry to adapt to the new requirement. Emails, facsimiles, etc. can be accepted as written orders, and the requirement will be implemented in phase. For example, in the initial stage of implementation, Part 1, the list of Part 1 poisons and antibiotics will be covered, and then later extended to lower risk drugs. For example, those in the list of Part 2 of the poisons list and drugs not included in the poisons list. Of course, if the profession has any further views on the proposals, they're welcome to present the views to the PPB. The next major issue is to require the authorized drug sellers to have a registered pharmacist on the premises throughout the operation hours. The ASPs must have a registered pharmacist on the premises throughout their business hours to replace the existing requirement of 2/3 of the operation hours. This is for the sale of Part 1 poisons on ASP premises, and we would like to enhance the existing regulatory regime. And community pharmacists can provide professional services to the public then. Just now I heard concerns and alternative proposals from the deputations. As we mentioned at the meeting of the panel on the 18th of November, in terms of actual arrangements, we have received certain inquiries from members of the profession. So we would examine the possible impact on SMEs upon the implementation of the recommendations. We would like to enhance the safety of sale of drugs. Let me give you some information. We have 2,000 odd registered pharmacies and 500 odd ASPs. Apart from these ASPs, the hospital authority, private medical practitioners, private clinics, pharmaceutical manufacturers, etc., also employ pharmacists. Given the pace of increase in the number of pharmacists every year, we envisage that we have to wait for a few years before we can have sufficient pharmacists to satisfy this new requirement. In our bureau, we have a review committee to review a number of areas, including the manpower requirements in terms of pharmacists. Just now, deputations mentioned the pharmacists trained by the two universities and the manpower requirement. This review committee in our bureau is also reviewing the situation. Apart from reviewing the manpower requirement, some colleagues just now also mentioned professional developments, professional ethics, and so forth. Now, all these issues will be discussed by our review committee, and we do have enough representation from the profession in the review committee. Having considered the situation of the retailers, we will only implement this recommendation later. So we understand the situation of the profession. So we'll consider the market conditions, the number of pharmacists available, and other factors before actually implementing the recommendation, which will then be gazetted. Through the COP, will regulate the pharmacists, and the proposal will be included in the COP and not in the ordinance. And and its subsidiary legislation. As for the ASPs, they will be required to have a pharmacist on site throughout their business hours. Now, this recommendation will not be implemented in the short term either. We'll consider market conditions, the number of pharmacists, etc., and will also fully consult the industry and profession before actually implementing the proposal. On the 18th of November, we already consulted the panel, and today we're very pleased to receive further views from the deputations. The legislative timetable will be modified. So now we'll not introduce the legislative amendments to LegCo in January 2014. We hope that members of the panel can support our legislative proposals so that we can timely introduce to the LegCo legislative recommendations to enhance the regime. If we have the support of the panel today, we'll be able to introduce the legislative amendments to LegCo in February 2014.
Chairman, just now, some colleagues in the trade raised issues of concern, and I'd like to defer to my colleague, Mr. Ng of the Department of Health, Ms. Wu, Assistant Director of Health, to address these issues on the control of key and on enforcement and on labeling, drug labeling. May I ask Ms. Wu to supplement on these points? Ms. Wu, please. Thank you, Chairman. Deputations have spoken just now, have given valuable views and comments to the administration and the Department of Health. There are a number of issues raised among the 75 recommendations. On written order and the presence of the registered pharmacists during business hours of the ESP's undersecretaries already made gave her responses. Now, on pharmaceutical products, if it's put in a locked receptacle, the key should be kept by the pharmacist. Chairman, under the existing legislation, the first schedule poisons are to be supervised by the pharmacist, and the key should be kept by the pharmacist. This already exists in the current legislation. Pharmacist should comply with this requirement, because, as we all know, drugs in particular, prescription drugs and Part 1 or first schedule poisons, they should only be sold under the supervision of pharmacists and on doctors' prescriptions. So the extension of the legislation is to include Part 1 poisons as well, so that they should be kept in locked receptacles. So the legislation will be extended to cover Part 1 poisons, so that pharmacists are required to keep the key for locked receptacles which contain Part 1 poisons. Just now, some deputations expressed their difficulties in observing this requirement, but I think for pharmacists in community dispensaries do have this responsibility. Be it hospitals or community dispensaries, pharmacists should ensure the safe storage and use of drugs and to serve members of the public in Hong Kong. Part 1 poison should only be sold under the supervision of pharmacists. Otherwise, it will contravene the laws of Hong Kong. Some deputations feel that the administration should step up the enforcement of the regulation. I'd like to emphasize that the administration attaches great importance in this regard. We closely monitor any illegal activities involving drugs, and we have frequent inspections on licensed as well as unlicensed premises. For unlicensed premises, on information of possible breach of the law, we do have inspections and we have operations under the Department of Health. We actively monitor the situation and we will initiate prosecution where there are breaches of law. Thirdly, on drug labeling, a deputation touched upon the labeling of drugs. In the current legislation, Part 2 poisons, drugs not prescribed by doctors, are required to provide instructions for use on the number of doses per day and number of pills to be taken per dose, etc. The labeling requirement will be subject to the decisions of doctors of community dispensaries. Should they find the need to enhance labels, this will be up to their professional judgment. There is no specific requirement on the wording of or content of labels. Nothing to supplement? All right. We have 35 minutes left. 5 members have raised their hands. Vincent Fang, followed by a number of members. Let me do the calculations and see whether we should limit to each to 3 or 4 minutes. Let's be pragmatic. 4 minutes, questions and answers included. Okay? I read out the names. Vincent Fang, Dr. Kwok Ki, and a number of members. Mr. Vincent Fang, thank you, Chairman. Thank you, deputations, for attending this public hearing this morning. Last time at the panel meeting on the 18th of November, the Secretary for Food and Health personally attended. He explained that this proposal had been fully communicated as far as the trade is concerned, and I recall that, Chairman, you repeatedly asked for a public hearing, and that's why we have the public hearing today. We thought matters were not very controversial, and yet this morning we've heard strong views and opposing voices to the administration's proposal. If the administration just disregards these opposing views, it will be unfair. Under Secretary, you mentioned a couple of points. First of all, you talked about written order of drugs. You said that it's not a concern of LegCo because this can be incorporated through administrative means, according to the wording of your paper, that it will be incorporated in a code of practice for the relevant personnel to observe, and instead of legislative control. So you can circumvent the electrical by doing it administratively. No legislation is necessary. And last time I also mentioned this point. The paper is vague, it's ambiguous. You talked about insufficient pharmacists. You say that you understand the situation, but the legislation should be passed first, and we will wait until there are sufficient pharmacists before you gazette the proposal. I think this is the wrong approach. It's just like writing out a blank check. A couple of questions. First, on the definition of premises. Please elaborate. There is a dispensary room at the back of a drugstore, usually. I think it's reasonable for the key of the dispensary room to be kept by the pharmacist. However, if the whole drugstore is treated as a dispensary, what about the sale of water and formula milk in the front portion? If the pharmacist has to be present during these times while these are being sold on weekends, the situation will be serious. And secondly, we have, according to the current legislation, only food and pharmaceutical products, nothing else. What about vitamin pills and supplements? There should be more categories. Under Secretary. Thank you, Chairman. Thank you, Mr. Fang, for your comment. I think last time, on the 18th of November, as in our paper, starting from 2009, we started, after the report was published, to communicate with members of the trade and stakeholders. We think ample time has been given. So last time we came to the panel, why don't we do it this way? Sorry. This will be a lengthy answer. Well, I will note the two questions and see if members are going to ask similar questions and wait for the answer in one go. Dr. Kwokaki. Thank you, Chairman. Thank you, deputations, for coming to the public hearing this morning and express your valuable views. Now, in the administration's regulation proposal, one matter is left out, and that is, as the pharmacists say, for those breaches of the PPO, very often the pharmacists, instead of the owners of dispensaries, will be punished. This is a big loophole. Although the key may be kept by the pharmacists, but we know that the bosses might be selling these poisons as well. If only the pharmacists are punished, and the owners of dispensaries are not subject to punishment at all, then even if they are busted on covert operation, they can easily change the shop sign and continue with their business. And only pharmacists will be punished. This is very unfair. I hope to see legislation as soon as possible to regulate bosses and owners of pharmacies. We can follow the EU practice. For example, the owners of pharmacies and dispensaries must also be registered pharmacists. Well, can this be done? And on recommendation 16 of the paper, the proof of clinical trial studies should have a history of 5 years. And will this create a bigger loophole? Because I understand that the clinical trials can have outcome faster nowadays. For countries with stricter regulations, the drug might have been banned, but in Hong Kong, the drug will still be allowed to be distributed. And on inspections for the performance is poor, is inadequate. So will more manpower be provided to step up inspection of pharmacies? Under Secretary. Thank you, Chairman. Thank you, members. On the second part of the questions, clinical trial on a 5-year basis, we note that for clinical trials, the valid period is only 2 years at present. And in fact, this is not adequate in completing the clinical trials. And that is why the review committee has proposed to extend the period from not less than 2 years to 5 years. I hope Dr. Kwok would understand this, and I'll defer to Ms. Wu to take the question on the keys and penalties. Thank you, Chairman. I want to clarify that if the facts of the case contains information on who sells the poisons illegally, etc., we impose penalty on the person selling prescribed drugs illegally. We will find out and impose penalty on the persons involved. So that depends on who committed the fault. So can the legislation be amended? I'll follow up on it, Dr. Kwok, if we have time. I've taken note of your question. That is, the owner should also be a pharmacist. Mr. Chen Han-Peng. Thank you, Chairman. Thank you, members of the trade, for coming here and expressing your views. We think that the principle of the legislation should be to safeguard public health, and we should uphold this principle. Therefore, we think for written order of drugs, this is important. It's better than placing order by telephone without written record. The errors may occur. For administrative means or legislative means, we should go ahead first, and I hope the administration would consider whether there will be any loopholes.
When a pharmacy opens for business, apart from normal drugs and medicine and prescribed medicine, there are other products and services. Therefore, it is not very realistic to require a pharmacist to be on the premises throughout the business hours. So I'd like to ask the administration, what's meant by at all times? Is it that from the very minute when the premises open for business, then the pharmacist has to be present, or only when the relevant drugs are sold that the pharmacist is required to be present? And if the pharmacist is not present, can drugs other than the authorized drugs be sold? Yes, and also please say something about premises as well. Well, the question just now was when the pharmacist should be present. At all times means when the premises opens for business for the sale of drugs, the pharmacist will have to be present. And then the chairman asked me to say something about the definition of premises. If drugs are to be sold, a license has to be taken out. For a licensed dispensary, then it will be the premises mentioned by Mr. Fang. So you mean a license for the premises? Yes, the premises has to be licensed. Mr. Chairman, for the sake of safety, when poisons or controlled drugs are sold, then it is reasonable to require the presence of a pharmacist. But if the requirement is that throughout the business hours of the premises, the pharmacist has to be present, then there will be huge difficulties for the profession, for the operators, and for all parties concerned. So I think you have to consider the reality. Don't leave everybody panicking when the proposed legislative amendments are implemented. So I think you should consult the industry and the profession first. We don't want to see a piece of legislation that is not practicable. Any supplement? No. Next, Mr. Charles Mock. Thank you, Mr. Chairman. I'd also like to thank the friends here for expressing their views today. I'm interested to know this difference in opinion on written orders. Some doctors said that they did not want to turn the clock back. I really don't quite understand the argument. As a general member of the public, I don't understand why exchanges are required at the time of placing orders. I hope that these stakeholders are not trying to protect their interest only. I really can't see why written orders cannot be implemented. Of course, implementation details have to be addressed. For SMEs, we may need to provide a certain subsidy. Yes, consultation should be done, but we cannot have consensus from everybody. Otherwise, like many public issues at the moment, the government is hands tied. And what about retail inventory management systems? They can be linked up to the computer systems of the wholesalers. That sort of linking system is good because if I cannot obtain a certain drug from you, I can approach another supplier. For manufacturers associations, can they tell us whether or not this is possible? Computer technology is no problem at all. The question is whether or not you would like to make use of computer systems. Under Secretary, concerning exchanges, for this requirement of written orders, we are requiring orders to be placed in writing, but we are not prohibiting any exchanges, for example, before the placement of orders. But the actual orders have to be in writing. As for placing orders, we understand that the industry and the profession may have to change their existing practice slightly. Maybe standard procurement forms can be prepared in the form of templates for the use of their customers. That can also reduce workload. As I mentioned just now, apart from typewriting, emails, facsimiles, and any document in writing can be acceptable. So you mean inventory management systems can also be put in place. Maybe you can have an order management system to connect the two sides. That is the safest and most effective method. Well, we've heard that piece of opinion. Perhaps industry can look into this suggestion of inventory management systems. Any response from the deputations here? Yes, please. Sorry, the speaker is not coming through. As this honourable member mentioned, the hospital authority does have an inventory management system. For big entities, they can do so. But what about smaller enterprises, like a small pharmaceutical manufacturer, with Hon Members distributing 80% of the drugs in Hong Kong? Concerning Mr. Mark's suggestion, we're already doing that internally. We have a similar system. Whether or not that can be applied to the orders placed by doctors and patients, we're very willing to carry out pilot schemes with parties concerned. Dr. Fernando Cheung. Mr. Chairman, I'd like to thank the deputations for coming. As for the 75 recommendations put forth by the review committee, the more controversial ones include written orders and the all-time presence of pharmacists. I think both recommendations represent an improvement. Written orders are being done throughout the whole world. All-time presence of the pharmacist is also an improvement, so we support them. The question is how to implement them. We also need sufficient manpower to support its implementation. At present, we don't have enough pharmacists, but we support the recommendations themselves. For written orders, in 2007, 5 patients died because of wrong prescriptions. At that time, the jury proposed written orders and detailed records. From 2007 to today, 6 years have elapsed, and 2014 is coming. But written orders are still not implemented. As for the whole regulatory regime, I heard that most of us here are in support of segregating the medical profession and the pharmaceutical profession. Apparently, the review committee has not handled this. So I'd like to have the view of the administration on this. You now want to enhance regulation on drug supply so as to enhance the protection for patients. And the segregation of the medical profession and the pharmaceutical profession is also heading towards that goal. Well, we understand this segregation issue, but this time for the amendment of the PPO is because the review committee had done something and recommendations had been put forth. But this segregation issue has not been raised in the review report, but we've heard the views here. In our bureau, we have a steering review committee covering 6 professions, and pharmacy is one of them. In that steering review committee, we do consider professional development, and this so-called segregation issue is one of the issues that we look into, and that represents an improvement as well. For the roles of medical practitioners, pharmacists, and patients in relation to habits and procurement, etc., segregation of the professions may represent an improvement. So we'd like to have sufficient discussion for all stakeholders to have sufficient time to air their views. So in our bureau, we've already provided a platform for such a discussion. Well, let me give you a piece of information. At the moment, if a patient so requires, he can ask a doctor to write a prescription for the procurement of drugs in a community drugstore or pharmacy. As I said, our committee will discuss this. Do you have a timetable for this segregation issue? Simple reply, please. Time's up. the review committee has already convened a few meetings, and some recommendations have been raised. In the coming year, we'll discuss two issues: professional development and manpower level. Yes, I believe we'll continue to discuss these issues next year because we already had a number of meetings on that. Dr. Elizabeth Quat. Thank you, Chairman. I'd like to thank the deputations and professionals for attending this meeting today to present their invaluable advice to us. For the 75 recommendations, they put public safety as the first and foremost concern. That's correct, but we have to consider practicability and reality and the impact on medical practitioners and pharmacists. May I clarify something from the administration? Well, written orders is one of the controversial points today. Will electronic records be included as well? Well, emails are allowed, but there are other electronic means. Will they also be included? In the long run, I'd like to follow up on Mr. Charles Mock's proposal of introducing an electronic system. If you have a good electronic system, future management problems can be solved. You should also consider that when the HA upgrades its platform, it should consider providing a platform to facilitate the industry to order drugs. And there's another controversy. That's about the impact on dispensaries and pharmacists. Some of our colleagues already said that to require a pharmacist to be on the premises at all times may add to the burden of dispensaries. Now, we're told that the legislative amendment will not be implemented in the short term. The industry is worried. You say you further study and discuss the issue. Then we'll all have a lot of question marks in our mind. If we don't have enough pharmacists, why do we need to legislate now? Why can't you discuss with the stakeholders and settle everything first before implementing the amendment? We all understand that it is reasonable to require the presence of a pharmacist for prescribed drugs. But for other services and products, if the establishment has to close down without a pharmacist present, is unreasonable. And the segregation of the two professions should be considered by the government in the long run. So I'd like to know what progress we'll expect in the near future.
The Secretary. Thank you, Chairman. Thank you, members. And to respond to two of your comments on electronic records, the principle is as long as records can be kept, electronic means can be allowed. The principle is to have records. This is our focus because we'd like to have the procurement chain documented. So an electronic platform can do, and on pharmacists being present at the premises during business at all times. We understand at the moment manpower is not sufficient, but as Dr. Fernando Cheung said, this is an improvement. This is also a step towards the correct direction. There are various recommendations in this legislative proposal, and this is the correct direction, we feel. As for the implementation date, it will be subject to consultation later. We won't bulldoze it through. Now, on the question of regulating vitamins and supplements, please answer this question as well. Now, the second question of Mr. Vincent Fang was that sometimes nutritional supplements and vitamins at present can be sold by direct sales without the need for license, but they will be put under regulation. In your proposal, I wish to clarify that if it's not classified as drugs, the seller are not required to obtain a license. So what if they claim that is vitamins? They claim that they're not drugs. Vitamins are drugs. So for retailers selling vitamins in future, they will be required to obtain licenses first. I'll defer to Assistant Director, perhaps. Is there a misunderstanding by the trade? Thank you, Chairman. Now, under the existing legislation of PPO, we have poisons as well as non-poisons. Because there is a poisons list in the regulation. For non-poison products, they are vitamins. For example, it's not part of the poisons control, but they are drugs. That's why all vitamins have to be registered in Hong Kong. Otherwise, it will be against the law. So for poisons and non-poisons, this is a tighter control on drugs. In fact, all drugs have to be registered. We talk about enhancing regulation because if you're importer, exporter of drugs, at present you need to obtain a certificate. Now please be more succinct. For example, sale of shampoo, vitamins, at present no license required. In future, wholesale of non-poisons under our regulation to step up control will be subject to regulation that applies to wholesale. At present, for import of vitamins, they're subject to control. For retail, however, they're not subject to regulation. In future, the wholesalers will be regulated. What about the question put by Dr. Kwokaki that bosses of dispensaries should also be registered pharmacists? I think we note the question. There will be changes from existing practice. You note this. That means you go back and consider it. All right, Chairman, yes? Definition of premises. Her answer was that at the time of issuing a license, it will be stipulated. Now, the definition of premises is that license will be given to premises selling drugs. That's the definition of premises. Now, very often, the administration regards the whole of the drugstore as the premises. But in future, can you separate the dispensary room at the back from the front portion where formula milk and other stuff are sold? So can the license and the premises be confined to the dispensary room? Can this be done instead of the whole drugstore? But the dispensary room, in fact, is part of the premises. Yes, part of the whole premises. You haven't been to those drugstores? There is the reason for me to ask this question. Right, Mr. Wong Ting Kwong. Under Secretary, can you explain in greater detail? I understand for licensed premises, you may be referring to the whole business area. That might be the definition of premises. But what is the reason of issuing licenses? Because they, in their operation, controlled drugs are involved, namely poisons. And if the pharmacist is present, the whole premises can then conduct business in relation to controlled drugs. However, if the pharmacist is not present at the premises, the part of the business concerning controlled drugs will be suspended, and therefore the premises should not be subject to the control of your license in relation to the businesses not related to the subject of control. The sale of formula milk, sale of bottled water, this part of the retail business is not the scope of your regulation. Therefore, the license doesn't apply to the sale of these items. If, however, they sell controlled drugs without the presence of the pharmacist, they will be breaching the law. Can I take it this way? Under Secretary or Director, Assistant Director, the definition of a drugstore is that the premises should be registered first, and in the premises, sale of controlled drugs can only be conducted under the supervision of pharmacists. And the current law states that the pharmacist should be present at 2/3 of the total business hours of the drugstore. Sorry for interjecting. Let's make it easier for everybody to understand. 2/3. I understand that this requirement will be changed to 100%. That means only when the pharmacist is present can such drugs be sold. Yes, I agree. Now, what if the drugstore only opens for business for 12 hours and the pharmacist is only present for 6 hours, and during the 6 hours, all items including controlled drugs can be sold. For the remaining 6 hours, the pharmacist is knocked off. Either he goes home or he goes to another drugstore. And during these 6 hours, no prescription drugs or controlled drugs will be sold. Yet I can still sell other non-controlled drugs, formula milk, lozenges. I can sell these items not under control. Is that the case, or is it that as long as the pharmacist goes away, I need to close the door? So please make it easier for everybody to understand. You can talk about law. I understand, but I'm not sure if people, deputations here or the audience upstairs understand. I need to extend the meeting by 15 minutes.
Under Secretary, any response? Mr. Wong, first of all, I have to thank you for your opinion. Well, please be succinct. You don't need to repeat points that have already been made. I understand, but I have to put my remarks in context. Of course, due to time constraint, I'll now be more concise. For our new proposal, what you said is correct. Yes, once you open for business, you need a pharmacist on the premises. Without a pharmacist, you cannot sell other products. Oh, I can't even sell other products. Mineral water, denoting lozenges, shampoo, whatever? Yes. Now, Mr. Vincent Fang asked you about the definition of premises. Well, let me say this. We'll just assume that other laws allow the proprietor to have a so-called SDU, that is a separate room on the premises, and that is the dispensary. And he only applies for a license for that particular room. And then for other portions of the premises, he sells uncontrolled drugs, baby formula, etc. All right, so that is a licensed room. Or if he's very, very rich, he can have two premises, one big, one small. The smaller premises will sell controlled drugs and under one big signboard. Well, Mr. Chairman, in that case, he cannot use the signboard dispensary or pharmacy. We'll let her answer first. Would that be allowed? Mr. Chairman, it depends on the law. You're running a pharmacy, and in accordance with the law, for 2/3 of the time, you need a pharmacist present before you can call yourself a pharmacy. On top of the premises, you can put a logo and other ancillary facilities. Say if a company wants to cut up his premises into 2 portions, well, he has to observe the law. He can apply to us, and he submit a plan to us on his premises. Say if here I have a segregated portion, a so-called SDU, to be used as the dispensary. So he has to submit all these information to us. All controlled drugs will then have to be sold in that particular SDU, so to speak. But don't forget that there are Part 2 poisons and other products sold. Part 2 poisons are also medicine or drugs. If other parts of the premises do not sell Part 2 poisons, it may be all right. It depends on the actual arrangement. Well, a simple follow-up question on written orders. Is a signature required? Will a chop suffice? If you use an electronic means, well, we only require a piece of evidence. If it is a facsimile without a doctor's signature, will that be acceptable? We'll accept that. We just want evidence. Let me see whether there are any outstanding questions. I have to ask panel members whether or not they support the enhanced legislative proposals. Dr. Elizabeth Quat said that she would not support the proposals. As for the final reply from the administration, that is, a pharmacist has to be present at all times of the business hours, I don't support it. I think the department should go back and reconsider this. But, Mr. Chairman, this is really a pity. The other recommendations are important, and I support them. So on this particular recommendation, I'd like the administration to modify it or postpone its implementation. If that's the case, the administration has to go back and reconsider this after listening to so many views. Maybe they need to come back to this panel to tell us whether or not they have any modified proposals. If there's no further comment and no other business, I'd like to thank the deputations and individual members of the public for attending this meeting to air their views. So, administration, please go back and reconsider this. Thank you. Meeting adjourned.